Deion Sanders, the coach of the Colorado Buffaloes, just came out saying that he had bladder cancer, and his medical team has said that he's now cancer-free after removing his bladder. What does this all mean? First of all, thank you, Coach Sanders, for being very vulnerable and raising awareness about bladder cancer. Mr. Sanders posted an Instagram reel showing himself fishing in recovery with his catheter bag. As a urologist, this makes me really, really happy. I wish Coach Sanders the speediest of recoveries, and this video is meant for educational purposes. Bladder cancer is a topic I care about deeply. It is what I am researching in my 4th year as a urology resident. Bladder cancer is the 6th most common cancer worldwide, and last year in 2024, it took 16,000 lives. To start off, let me describe to you what the bladder is and what it looks like. So the bladder has 3 main layers. The first layer is called the urothelial layer. The urothelial layer, or the bladder mucosa, is about 5 to 7 cell layers wide. Underneath this mucosa is the lamina propria, which is a connective tissue layer. Underneath the lamina propria is the muscular layer. So what led to the removal of Coach Sanders' bladder? Bladder cancer is usually diagnosed with a clinic procedure called a cystoscopy. This is when a urologist takes a long, thin camera, puts it through the urethra into the bladder to take a look at what's inside. An imaging study could also show a bladder mass. Oftentimes, these patients present with blood in their urine, which prompts a cystoscopy and/or an imaging study. If something concerning is seen on imaging or on cystoscopy, the patient is then taken to the OR for something called a TURBT, or a transurethral resection of the bladder tumor. Here, we take a long scope with a loop at the end of it that can then scrape off the bladder tumor. This tissue is then looked at under the microscope by a pathologist. They will determine which layer of the bladder wall the cancer has reached. If the bladder cancer has hit the muscle, the standard of care treatment is to remove the bladder. But per his medical team, the cancer had not hit his muscle yet. He had something called high-risk non-muscle invasive bladder cancer, where the cancer has very scary invasive features, but is in that lamina propria layer, not the muscle layer yet. Per the literature, this type of cancer has a very high chance of progressing to the muscle invasive kind. And once it gets to the muscle, then the survival of the patient decreases. So even if this kind of cancer hasn't hit the muscle yet, if it keeps coming back or doesn't respond to treatments, then the patient and their urologist can have a conversation about proactively removing the bladder. When they remove the bladder, they also remove the lymph nodes to where the cancer is most likely to spread. If the lymph nodes don't have any cancer in them and the cancer in the bladder hasn't hit the muscle yet, then the 5-year survival outcomes are very good. But then how do these patients pee? Kidneys are connected to the bladder via the ureters. The ureters are either hooked up to a continuously draining pouch called an ileal conduit, or they're hooked to a newly made bladder pouch. Both of these options are made from your intestines. I hope this helps, and once again, thank you, Coach Sanders, for raising awareness. If you or a loved one has blood in their urine, please see your primary care physician immediately. They will evaluate you thoroughly and decide whether you need to be screened for bladder cancer.